Hi, this is Dr. David W. Kim, and today's video rhinoplasty blog is about the external versus endonasal approach to rhinoplasty, or the open versus closed approach. Patients sometimes ask me which approach I'm going to take, and as most of my patients know, I prefer an external approach, and I'd like to explain why. Several decades ago, rhinoplasty was almost exclusively done through an endonasal or closed approach. However, the tides have changed, and over the past 20 years, an increasing number of surgeons prefer the external approach, which is my preferred approach.
There are lots of reasons why the external approach, I believe, is the better way to take care of rhinoplasty. The biggest reason is that the nose is like a building. It's very structurally important. All of the components of the nose are put together in an architectural design that relies on the stability and support of all of these structures in order for the nose to remain stable. With an open approach, we are maximally able to maintain strength to these structures. When a non-structural approach is taken and these structures weaken, there are consequences. The building collapses and there are functional problems and cosmetic problems. I find it much more difficult to restore these structural relationships through an endonasal approach. One example is when a hump is taken down from the bridge of the nose. Without any further work, if the cartilages in the hump area are left to heal on their own, they'll collapse inward, creating pinching. Through a structural external approach, it's much easier to put small grafts here called spreader grafts, which can prevent this complication. The tip is another area where this type of pinching can occur if a non-structural approach is taken. This is a post-operative patient, not my own, who I treated with revision rhinoplasty. She had very aggressive endonasal destructive techniques to try to narrow her tip, but because the structure was not stable, collapse ensued and she had functional as well as cosmetic problems. This is a different patient who I treated with primary rhinoplasty. The nose is triangular in shape. Structural stability is afforded through the external approach in this case, so the nose looks better but also functions properly. One of the criticisms early on about external rhinoplasty was the visibility of an external scar. Fortunately, if the scar is placed in a very precise manner, and I tend to use this inverted V or upside down W configuration so that the lines take on different vectors, allowing for maximal camouflage. With a precise closure, this type of incision will heal to a point where it's virtually invisible. This is a post-operative patient, and you can see that the scar is essentially non-visible to the naked eye. The other advantage of external rhinoplasty is that it allows for precision. Endonasal or closed rhinoplasty utilizes incisions inside the nostrils, and it's largely an operation performed by feel. Open rhinoplasty is an operation performed under exposure and visualization. And because rhinoplasty is an operation of millimeters, precision is incredibly important to get a good outcome. Particularly in a thin-skinned individual, if the work on the cartilages is done in an asymmetric manner, leading to contour problems, you will see these problems through the skin envelope. External rhinoplasty allows for modification of all of these structures in a very precise, symmetrical fashion to allow for a maximal cosmetic outcome, even in a thin-skinned individual like this.
For the reasons that I explained, I strongly prefer the external or open rhinoplasty approach to perform my surgeries. The exposure and visualization gives me an advantage in being able to be very precise with my work and also allowing me to restore all the structural relationships inside the cartilages and bone in order to prevent complications. I don't think necessarily that endonasal rhinoplasty will lead to a bad result every time. It's just that I think external rhinoplasty is a superior way to approach the nose to prevent complications and create good aesthetic outcomes. Thank you.